So for this discussion, I had questions 3.5, which says, at the practical level, the theory of complex responsive process of relating provides a social, psychological explanation for the unique connections between relationship-centered care and narrative healthcare. So the relationship-centered care, or RCC as I like to call it, is basically a theoretical underpinning of the complex process of relating, and it's based off 3 social interaction theories. It's very multifaceted, so there's a lot more going on to it, but there's one element that particularly applies to healthcare providers, which is that self-organizing patterns of meaning that meaning and relating to others is very important for us as healthcare providers and for the human beings in general. So the theory kind of states that as people interact together, they negotiate together so that they can move on together and move forward from their interaction. And during these interactions, common features of interacting are responsing, turn-taking, sequencing, and rhetorical devices. These features therefore allow for people to communicate with each other, and when they're communicating with each other, they're also communicating with themselves. These communications really, there's a implication of small differences, which means that little differences from each person ends up making a different meaning for the whole conversation. And these implications of differences can really make a big difference in healthcare, and it could be the difference between providing holistic care or treating a patient biomechanically and not resolving all of their issues, or maybe not even getting the right diagnosis and helping them heal with what's actually going on. So this just shows how important the use of RCC is for our patients. My next key ID was 4.6, which says, placing the needs of your patient above your own, the obligation of altruism is essential ingredients of narrative confidence. So the book kind of talked about how altruism is pretty much the essence of all of the professions, especially in healthcare. I know in OT it's one of our core code of ethics. It's one of the main points that we emphasize. And the book talks about how you find a fine line between altruism and self-interest, and that to be an altruist you need to see a fellow human being, not a stranger. So you're treating a patient, you're trying to help them return to being, they're just a human being, they're not any less than you are just because you are able to provide them health care. This worldview is what helps separate altruists from not altruists, and the book kind of talks about how you cannot be truly selfless, you can't be truly altruistic because of what you gain from helping others, that there's a difference between legitimate and illegitimate self-interest. So to be truly altruistic, you need to find a balance between work and life, and to always remain altruistic when possible to help your patients, helping them with what they actually need for care, not what you want for your future as a professional in healthcare. Lastly, I had 4.7, which states narrative competence requires that caregivers develop their skills in self-awareness, reflecting, learning, and practice. Educators are obligated to ensure that this is sufficient time and space for such development in all areas of health professions education. So this kind of really focused on reflective learning and practicing, and having insight into your own knowledge, experiences, and what you're going through. Focusing on yourself is really what can help mind the gap between you and your patients, so it can lead to epiphanies or these aha moments. The book kind of talks about how it's necessary to develop this competence in moral students before they're treating patients, because a lot of the time clinical students will go out into the field and they'll have a high moral ground, but then they compromise these moral grounds due to pressure to perform academically. They don't want to go against the status quo at their sites. So if they're really self-aware, if they really understand who they are, then they will be more likely to follow morally what they feel obligated to do. So it talked about how a lot of schools were really pushing to add these to the curriculum, and how it also helps prevent burnout and promotes balance in life, and that using narrative could help do this, and it helps students create empathy. So if they know who they are, they know how they would feel when they're experiencing, it helps them connect with their patients, and ultimately that's what we want. Additionally, I wanted to talk about the story of Nicholas, who was a 6-year-old boy He had been diagnosed with an inoperable brain tumor. I found that this story was very moving. And the story goes on to talk about how after he ends up passing away, his mother donates his organs to several other children, who then gives basically some meaning to Nicholas' passing, which was meaningless in the sense of the tumor. And this really correlated how suffering can kind of be helped if you give meaning to it, and meaning and hope can really make a difference for your patients and their families. So for me as a provider, it kind of just reminded me to give meaning and hope to my patients as much as possible, however they define that themselves. So this mother defined it as what Nicholas would want, as planting trees because he liked to climb trees, and helping others because he liked to help others, and continuing his concentration with God because that's what he was interested in. Additionally, I watched the video with McCarroll, and I think she makes a really valid point that meaning and hope are essentially connected with God, and a connection with God can give you meaning and hope. So pushing my patients, if they have this connection, to continue that connection, or maybe giving them a chaplain to explore this, can help with this. Have a good day.